All right, everyone. Hello, and welcome to our last session of the 2025 Winter Ag Workshop Series. Today, we're joined by Ernest, who is the director of the Animal Diagnostics Lab, and he's going to be talking about biosecurity with us today. Just a couple quick things. We have the chat open, so if you want to share anything or if you have questions, you can drop them in that and we'll get to them. Your audio and video is off for the rest of the session, so use that chat box if you need it. At tomorrow, about a day later, you will get a resources sheet with some lessons, things like that, and also a reminder about the post test, so make sure you take that. And with that, I'm going to turn it over.
All right. Well, thank you very much. I appreciate the opportunity to be here with everyone. I'm just going to share my PowerPoint and get that started, and then we'll be underway. So let me get that going. And are you seeing my PowerPoint or are you seeing the presenter version?
PowerPoint.
Okay,
It looks
perfect.
good. Yeah.
Good. All right. So you just never quite know what's, I've done this often enough, but you never quite know. So all right, well, I will go through this, and if anybody has questions, we can certainly deal with those at the end, but I don't mind if you want to try and drop them in the chat. I'll see if I can watch that, but otherwise, Cassidy, maybe you can feel free to interrupt, and I can deal with questions that are pertinent to the slide or the topic that we're on. So. Well, I'm Dr. Ernest Hoving. I'm an extension veterinarian here at Penn State and clinical professor. I've been here just over 21 years now. I was Virginia Tech at the vet school before that as a faculty member there. And I was in private practice after I graduated from vet school, and then I decided to do a PhD. So I've been around the block a little bit. I'm really interested, especially in dairy cattle and beef cattle. However, when I was in practice, I kind of did the whole mixed animal thing. For those of you who are familiar with James Herriot, he was kind of my inspiration, and so I really enjoyed, working with dogs and cats and horses and cows and pigs and chickens and pretty much every species under the sun. So, so that was good. But I really enjoy what I'm doing now. Recently, I've become the director of the Animal Diagnostic Lab, and as we'll talk about in a few minutes, we're really neck deep in highly pathogenic avian influenza testing and have been for a while here at the lab. So that's a little bit about who I am, and we'll just get started with our topic. So we're going to talk about biosecurity and just kind of what is biosecurity, and maybe you'll get an impression or an idea of how that's important for disease prevention on our farms and what biosecurity kind of consists of and what a plan might look like or include. Then we're going to spend some time talking about the bird flu or avian influenza. And as of a couple of months ago, we would have primarily been talking about it in cattle, but here in Pennsylvania in the last couple of weeks, the whole situation has blown up again in the poultry side of things as well, or the avian side. And so we'll talk about that as well. And then we're going to briefly just talk about what we're doing here in terms of especially the testing that we're doing. And then just a few things about, you might have questions about this, but just a few things about this, especially from the dairy side, but we can also talk a little bit on the poultry side, what, from the consumer perspective, what's kind of important that way. All right, so if we start with biosecurity and what is biosecurity, the way that I'm going to define this, and varies a little bit depending on who you talk to, but I'm going to say that biosecurity is all of the measures that a farm would take or employ to reduce the risk of introducing pathogens onto a farm or into their animals. So that's one big aspect, is trying to reduce them coming into the premises. And then it's also important to try and reduce the risk of those pathogens spreading around the premises. So if one animal comes in infected, can we try and keep it to that one animal, or is that disease or that pathogen going to spread to many other animals, usually worsening the situation? And we'll also talk a little bit about how a biosecurity plan, although it's not directly intended to address human health, it does do that somewhat as well, just by the nature of it, and hopefully that will become clear as well. And then the other thing that sometimes we don't think about as quite as much is that there's also a risk to those pathogens, those bacteria, those viruses that are on the farm, potentially leaving the farm. And so we're going to talk briefly about that, not too much, but I think it's as part of a comprehensive biosecurity program, that's something else that should be considered as well. So that's what I'm going to define as biosecurity, and now we'll look at some of the different aspects of that. So starting with something fairly basic, but if we're talking about disease, right, because we're talking about pathogens and we're talking about disease, that's why this is important. And so a disease is really any condition of a living animal, human or otherwise, that impairs its normal functioning. That's a Merriam-Webster definition. And so there's a couple of different ways that we can classify disease, and we can talk about non-infectious versus infectious, and we can talk about clinical versus subclinical. There's other ways that we can categorize diseases, but these are two that are especially pertinent right now, and hopefully that will become clear as we go through this. But just to kind of look at non-infectious versus infectious, so non-infectious diseases are those that are not caused by a pathogen. So the main pathogens are bacteria and viruses, but there are other ones. So those are living organisms that cause disease in an animal. But the non-infectious conditions are ones such as nutritional or metabolic disease. So the cow that you see on the lower right here, one of the things that can happen after they calve is that they have a low blood calcium level because of the sudden demand for calcium in the udder as they're producing milk. And so that can lead to what we call hypocalcemia, or milk fever is the usual name given to that. And so that's a non-infectious disease, still a very important one, but we don't normally develop a biosecurity program for that type of a disease. Traumatic injury, so again, that cow on the lower right, if she struggles around too much, she might end up injuring her leg. She can either, wreck a tendon. She might actually fracture a leg or her pelvis or something like that. So that's traumatic disease. That's certainly a possibility. Neoplastic disease or cancer. And so what you see on the left there, that's picture in the center, that's a cow with a squamous cell carcinoma in the eyelid. That's again a fairly common non-infectious disease, especially in beef cattle that we see. But again, we don't develop a biosecurity program for that type of disease. And then toxins or poisonings, those happen as well. Again, theoretically, we could develop some aspect of our biosecurity program to address poisonings, but normally we just refer that more as a food security issue, not necessarily biosecurity, because again, it's not a living organism. All right, so that's all we're going to talk about non-infectious diseases, but what's more important or relevant to our biosecurity planning is infectious disease. And so this is where we have pathogens that invade or infect the body and then multiply and grow and thereby cause that disease that we had mentioned earlier. And so there's a whole list of organisms that can cause, that can invade and multiply and cause problems in the body, including bacteria and viruses, fungi, mycoplasmas, which are a type of bacteria without a cell wall, parasites, they fit into this category as well. And so those are the things that we're going to develop a biosecurity program to address. So can anybody, I guess, I don't know if we have if I can watch this on chat, but what makes a disease contagious versus infectious? I guess I'm just trying to see if I can see the chat here, but I don't know if anybody wants to type that in there or otherwise I can just go ahead. I was just telling Cassidy that I just came back from Harrisburg. I did a presentation on biosecurity there for farmers. And so we had a good interaction. It's a little bit more difficult to do on Zoom, obviously. But okay, so a contagious pathogen is one that is transmitted from one animal to another. Okay, so not every infectious disease is contagious, but every contagious disease is infectious. And so we can find bacteria in the soil, for example, that can invade and multiply and cause problems in the body. And those are not passed from one animal to another, but they're bacteria that are in the soil, and then they cause disease. So that's not a contagious pathogen, but it is an infectious one. So again, what we're usually talking about with our biosecurity is a contagious pathogen. That's really what we're addressing most of the time with our biosecurity plans. So there's a number of different ways that we categorize disease. We talk about endemic disease. And so endemic disease is disease that is always present at some level in a population. And exactly how we define that population can vary. So we might talk about this at the country level and say that in the US, disease X is endemic. That means we always have at least some herds or flocks with the disease. It doesn't mean that every herd has it, but it means that we have at least some herds that have this disease in their animals. It doesn't mean that every herd that has it has a high level of disease. It can be at a very low level within the herd, and it can be at a very low level across the country. But it is a disease that is present currently in the country. And so a herd that doesn't have an endemic disease is obviously very concerned about bringing that disease onto the farm. And a farm that does have an endemic disease still needs to be concerned about that disease because it shouldn't spread anymore within the herd to try and minimize the prevalence within the herd. So certainly biosecurity plans should address endemic diseases, whether that specific herd has the endemic disease or does not have the endemic disease. The biosecurity plan needs to consider those diseases. So then we can talk about foreign animal diseases. And again, the reason I put that in quotes is because what we mean by that usually is that we're talking about diseases that are not present in the country. And so the transborder might actually talk about that on a smaller level. So there might be a region of a country that doesn't have the disease. And so in that case, we usually talk about a transborder disease. But for all intents and purposes, they're pretty similar. And that means that the country does not, let's say, have foot and mouth disease. So here in the US, we had foot and mouth disease, which is a disease that affects cloven-hoofed animals and causes severe lameness. It causes blisters around the feet. It causes blistering in the mouth. It's a viral disease, but it hasn't been here since 1929. And so it's definitely one of the foreign animal diseases that we need to have on our radar, not only at the country level. So USDA, in terms of watching animals coming in and people coming in, need to have a national biosecurity plan. But an individual herd should also be thinking about this because it doesn't mean that we can stop everything necessarily at the borders. And foot and mouth is an excellent example because it's still in many other countries in the world. So countries that can't afford to get rid of it, it has perhaps gotten into the wildlife, and so wild animals can be affected. And so it's there it's an endemic disease in some other countries. And Germany, which has been free of foot and mouth disease for quite a long time, just a few weeks ago announced that they had discovered a case of foot and mouth disease in their animals. So that's a huge concern, both for the country, but also the individual farm, because those animals will need to be put down. And there's huge implications in terms of trade and the ability to export animals and animal products and so on. So a biosecurity plan at some level should also consider foreign animal diseases or transborder diseases as well. And then there's zoonotic diseases. So a zoonotic disease is a disease that is caused, it's a disease in people caused by a pathogen that comes from an animal. So the bacteria or the virus is resident in the animals. Usually the animals are not sick. So if we have cattle that are carrying salmonella or carrying E. coli, they might not be affected by that. It might not be causing disease in those animals. But if a farm worker or a visitor to the farm gets exposed to that pathogen, they can become sick or very sick, possibly as well. So a biosecurity plan is not directly meant to address zoonotic diseases, but it does indirectly because we're trying to control those diseases on the farm. And so by controlling them in the animals, we're effectively trying to reduce the risk that people are going to be exposed to them as well. Okay, so the biosecurity plan, we can list, dozens and dozens of bacteria and viruses and fungi and parasites that can cause disease on farms. but we're not going to develop a specific biosecurity plan for salmonella and develop another one for mycoplasma or mycobacterium and another one for E. coli and another one for a different disease. The idea is that the biosecurity program should be general enough to cover a pretty broad topic or a broad area of pathogens. Now, we might do some very specific things for a specific disease, but in general, we try and make these pretty broad so that it's something that can be followed and should be followed on a regular basis to try and reduce the risk of disease being introduced into the farm or spreading on the farm. Okay, and again, it can address all of those as well. So that's what we're trying to do when we're developing this biosecurity program. Okay, so sorry, let me just close this window. So we talked about infectious disease, and one of the things is that, sorry, back here, we talked about clinical versus subclinical disease, and there's a reason that this is important in this context of biosecurity plan, because a clinical disease is one that you can tell visually that that animal is sick, right? So on the human side of things, if somebody comes into class or comes home and their nose is drooling and they're, they look sick, their face is flushed, those are clinical signs of disease. It might not tell you exactly which pathogen they have, but they are showing signs of being clinically affected. So this pig that we have here, I don't know if anybody wants to take a guess as to what that disease might be called. There's one specific lesion there that kind of gives that away. So any guesses? It's in the skin and it's kind of the shape of the lesion that you're seeing there. So this is diamond skin disease, okay? So it's not, maybe not a very innovative name, it's just a rather descriptive one though. So when you see this, pretty much 100% can guarantee you that this is a clinical sign associated with erysipelathrix, that's a bacteria, Rhizopathiae if you want the genus name of that. So again, they're not all that clear, but this is a pretty obvious one and one that's pretty easy to diagnose this way. So again, that's a bacterial infection that pigs get. You'll see not every single one is diamond shaped, but that's a pretty classic one right there. So sometimes we'll see that the udder of a cow is swollen, so we know she has mastitis. Again, it doesn't tell us which pathogen is causing that, but we do know that she has some type of clinical disease. So the other thing that's really important is that we understand this idea of subclinical disease. And it's something that we perhaps don't talk about quite as much on the human side of things, but on the animal side of things, and it certainly can happen in people, but it's something we talk about pretty frequently in animals. And subclinical disease means that we just can't see that. So that cow that had mastitis, she might look completely normal, right? So 3, 4 days later, 7 days later, she might look completely normal again. And so we think that she's healed or cured because she doesn't have any clinical signs. Well, the reality is that she might still actually have subclinical disease. So she could still have an infection in the udder, even though she's not showing any of the clinical signs anymore. So that cow becomes a real problem because now we can't tell just by looking at her that she is sick, but she could still be shedding the bacteria that she has in her udder and therefore potentially causing other infections in other animals. And so it's important to understand which diseases have the possibility of being subclinical and which ones don't. And if we have the possibility of subclinical disease, we might need to make sure that our biosecurity plan includes some way to detect animals with subclinical disease, because they can certainly contribute to the spread of disease within the herd. Or if we ship that cow to our neighbor, but it still has subclinical disease, that's not a very ethical thing to do either. So again, this idea of subclinical disease is pretty important. Some cows can become infected with a pathogen and never show clinical signs. So that's another thing. No matter how carefully you watch the cow to see if she has signs of clinical disease, she might never, ever show signs of clinical disease. So that one is an extra problem because you never knew she was sick in the first place. And now she can be subclinically infected. So there's a disease that we talk about, mycobacterium, which causes Johne's disease, which when it becomes clinical, is very similar to Crohn's disease in people, but it has an extremely long subclinical phase where that animal is infected and actually shedding the bacteria that cause that disease, but they're not showing any clinical signs. And so that animal becomes a huge risk for infecting other animals in that herd. Okay, so as I've already said a couple of times, but our biosecurity plan should not only be focused on addressing diseases that might be present, but also those that are not present on the farm yet. And so we're looking at it to do both of those things. All right, and that's kind of repeating what I said as well, that we want to make sure that it's a fairly broad-based biosecurity plan. All right. So just at the risk of repeating myself, I just won't say that one. All right. So another thing that's important when we're thinking about disease control on the farm, or what's really part of a biosecurity plan as well, is understanding this concept of what has been known as the disease triad. Back when I was in vet school already decades and decades ago, we were talking about this epidemiological triad, or what are some of the factors that impact whether or not an animal becomes diseased. So obviously, as you can see here, we have a pathogen that's involved, right? So we're talking about infectious disease. So that's what we're talking about. But this model here recognizes that there's an important element here called the environment, or the the conditions that the animal or animals are living in, and then also that there might be host factors that are also important that determine whether or not an animal becomes diseased. So without getting into a lot of detail, I'll just give you a couple of examples, and I think you can probably relate to some of these. So the environment, we're talking about animal mixing, we're talking about stocking density, we're talking about temperature, humidity, ventilation, feed quality, how clean the animals are, so on and so forth. And as I'm sure you're all well aware, when August or September rolls around and kids start mixing in school again, it's not uncommon to see a lot of sick kids at that time, maybe even sick teachers, because what we're doing is we're bringing together a lot of, I was going to say animals, people from different sources. And again, we're starting to mix some of these pathogens, right? So we probably don't have a great biosecurity plan for the opening of school, but that might be something that, should be considered. And so one of the things that we see is we often see outbreaks of disease if a farm goes and buys animals from another farm or from an auction facility and brings them in. It's not uncommon to get an outbreak in that case. Often that's because they're introducing a new strain of the virus, let's say, that the other animals don't have, and so that causes that problem. I know one dairy farmer that I worked with a number of years ago. What he liked to do was go to the auction and find some good deals, right? So some cheap animals that he could raise for beef. Unfortunately, what he did, he brought them back to his farm and he put them right next to his cows that were in what we call the dry period. So the couple of months that they are not lactating before they deliver their next calf. And not surprisingly, the animals that came from the auction barn all got sick, got pneumonia, and a couple of weeks later, all of the cows in the dry cow pen all got sick as well. So that's similar to what we're talking about, kids mixing in groups or in daycare and things like that. So again, other factors that are important, obviously ventilation is an extremely important one. And so that's something that we need to do. So we talk a lot in animal agriculture about air exchanges per hour so that we're getting enough there. So we're not really building up a large pathogen load, right? So we'll talk about that when we come to the pathogen as well. But obviously, if we're ventilating the building really well, then hopefully the density of the viruses or the bacteria is not going to be as significant. And hopefully that will reduce the risk of an animal becoming infected with that. Hygiene can be a big issue, not only if the animals are covered in manure. Is that a problem from thermoregulation point of view, right? So if they have their hair is all nice and clean and dry, they can thermoregulate quite easily in very cold temperatures. But if those animals are covered in mud and manure, that becomes much more difficult for them, and again makes them more susceptible to disease. So when we're talking with a farm about managing disease, we're often focusing on the environment and saying, what can we do to improve this environment? And so one of the things we get at the lab here, we'll get calves in, and calves that have died, and this happened not too long ago. A farm was having problems because their calves were dying. well, we can diagnose certain bacteria in those calves or viruses in those calves, but that's not the main problem. The problem is that in that specific case, they were bringing animals every week. They were going out and bringing new animals in from different farms in the area, and they were getting a great deal on these calves. They were very inexpensive, but in the end, it was such a problem with all those animals mixing together and new animals continuously being introduced. It was a poorly ventilated barn, and they did not have a good amount of bedding in there. And so, we can diagnose the pathogen, but the problem there was primarily that the environment was really detrimental to the health of those animals. So the environment is also part of a biosecurity plan, really. So what are some of the host factors? Well, there's certainly a number of them, and here's just a few examples. In general, not always, but younger animals tend to be more susceptible to diseases. But again, it's if we get good transfer of antibodies in the colostrum in calves, then they might actually be fairly well protected. But that's an extremely important thing. So that's the passive immunity that I have mentioned right here. So that's giving the calves colostrum to give them that protection through the colostrum. Um, Innate resistance is just maintaining healthy skin. So as I mentioned, dirty animals can certainly have skin that is damaged, and there's certain bacteria that really like to grab onto or latch onto damaged skin. So if you have healthy skin, they're relatively easy to clean off of there or disinfect the skin. For example, the teats before the cow gets milked, they get wiped off and they get disinfected. But if that teat skin is damaged, it's much easier for the bacteria that might be there to stay and grab onto that tissue that's damaged and make it more difficult to get rid of those bacteria. So active immunity is another really important thing, and we spent a lot of time with the farmers talking about this. But active immunity is where we give vaccines. That's the main way. Obviously, if an animal is exposed to disease, they might develop their own active immunity. But what we're usually doing is we're trying to vaccinate animals so that they develop immunity to some pathogens and hopefully are more resistant to them because they've been vaccinated against them. And then production status. So again, an animal that is not lactating, we'll call a heifer, she might have a lower risk than an animal that's lactating because that cow that is lactating is putting a lot of her energy into producing that milk. But conversely, it could be the other way around as well, because a heifer, before she's lactating, she can actually get an infection in the mammary gland, and it's not being flushed out on a regular basis. So a cow that gets milked 2 or 3 times a day, that milk is getting flushed out of the udder 2 or 3 times a day. And that means that if there's a bacteria that gets up in there, it gets flushed out as well. So again, host factors can be extremely important. There's a genetic component, just as in people. Some people are more resistant, quote unquote, to disease, and the same thing we can see in animals. So then lastly, on the pathogen side of things, the dose, we were talking about that earlier. So if we have a poorly ventilated building with high humidity, we're likely to have a higher dose of the pathogen. If we have bedding that is not well maintained in the cow's environment, we can have a very high bacteria count. So we have a way that we can measure that. So that means that we have a higher dose of the pathogen that the animal is exposed to. And then we can talk about infectivity and virulence, and we'll talk about that a little bit more when we talk about highly pathogenic avian influenza. So those are some of the things that are also important as we start considering a biosecurity plan. All right, and then since we talked about contagious diseases, right, this is transmitted from one infected animal to a non-infected animal or a susceptible animal. So we need to think about how it gets from the one to the other. And so it's good if we can kind of group these into large categories, because then we can deal with them a little bit more easily than doing every single specific bacteria out there. So one of the categories we talk about is airborne, right? So not surprisingly, these are some of the bacteria and viruses that cause pneumonia. Just like in people, right? If there's somebody in the room who's coughing a lot, there's a chance that you're exposed through the airborne means of exposure to the viruses or bacteria from the other person. Well, the exact same thing is true in our livestock animals, that they can be exposed that way. An even bigger risk, if you will, is this fecal oral transmission. So that's something that we hopefully don't see quite as much in people, but it's not uncommon because, as you can imagine, and if you haven't been on a farm, but there's manure a lot of manure around. And so we can find pathogens in the manure. And if some of that manure then gets into the feed or into the water, it might not be noticeable by the cow. It can be a pretty low level, but it's not uncommon for feed to become contaminated. And so then we end up with a fecal oral cycle, and that animal is probably going to be exposed to some bacteria from the neighboring cow, like the cow that's in the stall next to her, one of her pen mates, rather than her own pathogens. And so one of the things we really have to do with our biosecurity program is control airborne diseases, but also fecal oral diseases. So we spend a lot of time talking about how do we try and prevent feed from becoming contaminated? How do we try and prevent water from becoming contaminated? Direct contact is another method, and so this is where usually nose-to-nose contact. There's relatively few skin diseases, for example, that would be another possibility, but most of this would be nose-to-nose contact. So again, somewhat similar to airborne, but this direct contact, can't go more than a couple of feet, and so it's a really direct contact means of transmission. If we have a disease that is airborne, then it doesn't make a whole lot of sense to separate a sick cow from a healthy cow by the space of only a couple of feet. That's probably not going to be very effective, right? But if we have a disease that's spread by direct contact, then as long as they can't touch noses, we're probably going to do a pretty good thing by separating the one sick cow from the healthy herd mates. And so again, understanding a little bit about how these diseases work is helpful to implement good biosecurity measures. And then lastly, this is another really important thing to consider, is that we can get exposure from the environment, although we're, again, talking mostly direct transfer from one animal to another, but that can happen through fomites. And I don't know if anybody knows what a fomite is. If you have in 2 seconds, you can type in what a fomite is, but if you don't know, I will reveal all. Don't see anybody there. So, all right, so a fomite, that's an inanimate object, okay, and it becomes contaminated with a pathogen, and then that inanimate object transfers that pathogen from the infected animal to a susceptible animal. So there's a number of different ones. So here's one example. So if this calf right here, for example, has a disease and this bucket becomes contaminated, and the farmer doesn't wash this bucket out very carefully and uses the same bucket for the next calf, down the road. They don't. Some farms actually mark the bucket with a pen number. Oops, sorry. But in this case, if they would use that bucket for the next calf or the next calf down the road, we might have the transfer of bacteria or viruses by means of that bucket, right? So that's an inanimate object. Another one, we often put these boots on, right, when we go to farms. Well, they're not magical boots. So they'll prevent, as long as they don't get torn, they'll prevent, oh, sorry. They should prevent what's on your shoes. Come on, we can do this. So they should prevent what's on your shoes from getting onto that farm, right? So they can probably stop the introduction of a pathogen, but they can rip. And so that's what I'm trying to show here. This is actually a boot that I had on. They can get torn. And so if you have manure on the bottom of your shoe from another farm, you can leave it on this farm, and that's introducing new disease. But if you walk through manure from the mature cows on this farm and then go over to the calves, these aren't magical boots. They still carry that manure over there. And so in that case, it's still acting like a fomite. And so we still have to be careful that we're not doing that. I don't know if anybody knows what these are, but in the interest of time, I'll just answer my own question. These are what we call esophageal feeders. And so when a calf is sick, we use this because a calf will not nurse often when they're sick. They won't feel like nursing, but it's important to get fluids into them. So rather than having to try and hook up intravenous fluids, we take this rod and we put it down the esophagus, and we can give them electrolytes and fluids to restore them to health. And that's an extremely effective thing. But if we also feed colostrum with this, sometimes we have a calf that won't drink her colostrum, and then so we feed them with that. Well, if we just use this on a sick calf, and now we don't clean it well, disinfect it well, and we go and use it on a brand newborn calf, we can certainly run the risk of infecting that newborn calf with the bacteria or viruses from one of the other sick calves in the herd. And then one other thing here as an example. So sure, when you go to the doctor, you wouldn't be very happy if they were using a needle that they just used on the person before you, or maybe that they were using last week because they want to save some money. Again, on the farming side of things, it's not uncommon, and it used to be that it was expected that you would use a needle until it was so dull that you couldn't get it through the skin. But now the expectation is, or needles are produced to be single use. However, the temptation is, again, trying to cut costs a little bit, that the needle is not replaced every time. And so if the needle becomes contaminated, if we stick it into an animal that has a bloodborne disease, so bovine leukemia virus, that's a virus that can be in the blood of the cows, the tiny little bit of blood can get on this needle, and then we inject the next cow using the same needle, we can now transmit that infection via this needle. And so again, we stress very strongly to try and have only single-use needles to try and prevent that infection from spreading within the herd. All right, so this is kind of the big picture of what we've been talking about, but we're trying to prevent infection from coming onto the farm, right? That's important. And there's a number of different things. Sorry, sensitive touchpad here. So animals are certainly a huge risk, right? They can, if we bring animals in, that's a big risk. People coming onto the farm, again, we need to think about the relative risk here. So a farmer from down the road who also has cattle, if they come to visit your farm that has cattle, that's a pretty big risk. If you've got a kid from downtown Philadelphia who's coming to visit a farm, they probably have really small risk of bringing anything on their shoes, except maybe goose poop onto the farm. So they present very little risk. It doesn't mean we shouldn't do anything with them in terms of trying to demonstrate good biosecurity, but relatively speaking, that's very little risk. Same with equipment. So one of the things we sometimes see is with hoof trimmers, for example, especially in the old days, they would do hoof trimming on one farm. They wouldn't clean their equipment and it got pretty dirty. They would go on to the next farm, and not surprisingly, you would see that some of these diseases would spread from farm to farm. And the same could happen if the veterinarian didn't change their coveralls or clean their boots really well. They're obviously working with sick cows a lot, and so they have the potential to move infections from one farm to another. And again, there's things that we can do before animals come to the farm or people come to the farm, but sometimes it's kind of too late, right? The barn door is already open, and so sometimes we have to do things after they arrive. And again, we're not going to get into all the details of this, but there's different ways that we can put up different levels of biosecurity or preventive measures there. So then we talked again about diseases spreading on the farm. That's also important to consider. So theoretically, if you're a completely closed farm, you won't have any animals coming onto the farm, so you can eliminate this risk. If you have very strict visitor policy, you don't allow visitors, and ones that do come, you insist that they wear Tyvek suits and boots and everything else, you can really reduce the risk here, and same with the equipment. But you still have some risk from wildlife, for example, and then you still run the risk of that disease multiplying within the herd. So those are things that really need to be considered. So again, we're not going to talk any more detail really than that, but we can put boot washes in place, so we can do that here. Like I said, we have Tyvek if you want to wear Tyvek coveralls. If you want to go into a commercial poultry facility, you pretty much will, I guarantee you'll have to put on Tyvek suit. In some places, it's even shower in. You have to have a shower before you're allowed to go in. So. Okay, so what we've been focusing on so far is largely prevention, right? We've talked about how we can prevent the disease from coming onto the farm, how we can prevent new animals from becoming infected. But the other really important part of a biosecurity plan is to think, well, how am I going to identify an animal that is infected, right? Because unless I have a perfect biosecurity plan, the chances are I'm going to get an infected animal once in a while. Hopefully that'll never happen with foot and mouth disease, but salmonella or E. coli or something like that, we do run the risk of that. So how can I identify that animal? And again, that's going to make this talk way too long, so we're not going to get into details. But again, to have a good strategy to identify an animal that is sick, either clinically or subclinically, is extremely important to be able to do that. And then we also have to have a good strategy for managing that animal. So as I just said, if we earlier, if we have a cow with mastitis, she has clinical mastitis. Let's say after a few days, that mastitis appears to be gone, and that's all we do to manage it. That probably is not adequate in most cases. We probably need to test to make sure that that bacteria is really gone and that she's not subclinically infected at that point. So that's really this prevent, identify, manage, an approach that I use a lot when I'm talking about different diseases. It works for pretty much any disease that you can have, any infectious disease. Um, and so that's a pretty important part of an overall biosecurity plan. All right, let's switch gears here, and we're going to talk some about biosecurity, certainly, when we're talking about avian influenza, but we'll talk a little bit more broadly about it as well, but we'll see how biosecurity plays into this. Okay, so avian influenza, it's in the news. I'm pretty certain you've been hearing about it. And in some ways you would think that it's just been discovered, that it's something new, but avian influenza is not a new thing by any means. It's a virus, a viral disease, and it's been around for decades and decades and decades and decades, and probably even decades before that. Just like influenza in people, we've had influenza in birds forever, so to speak. And the one thing that we see on the influenza side of things is that it tends to be that we see it a lot in wild birds or migratory birds and waterfowl. So these are the migratory flyways that we have in the country here. There's the Atlantic, the Mississippi, the Central, and the Pacific. And the birds tend to migrate along these paths. Not perfectly, right? There's always some that don't follow the map, but this is what they happen. So Pennsylvania's right here, right in the middle. We're nicely covered by the Atlantic flyway. And so what happens is these birds migrate north. They tend to mix at the top of the flyway, so to speak, right? They get together in Canada for their parties. And what they also do when they're mixing up there and having their social time, they also tend to mix the viruses. So what we'll see is that viruses from here and viruses from here, all influenza viruses, they can mix. And what happens when you get viruses mixing is that you get mutations happening. So again, these mutations are not a new thing by any means. But it just so happens that sometimes when you get these mutations, they can be what we call highly pathogenic. And that means really deadly, right, to domestic birds especially. So a lot of our wild birds can carry these viruses and not be overly affected. So they might look fairly healthy and pretty normal, but when their droppings end up in the fields for around our commercial poultry facilities, the domesticated birds tend to get very sick. Now, what's different with the mutation of this virus that we're seeing that started in about 2022 is that it's also pretty highly pathogenic to our waterfowl this time. So I don't know if you've seen stories, but there was a significant die-off of snow geese in Pennsylvania, and I don't remember how many hundreds and hundreds died, but we're seeing much more of that. So you might be seeing stories where raptors are dying, and it's much more deadly to the waterfowl, especially this time around. This mutation is so that's a little bit of a different thing. Doesn't mean it's necessarily scarier. It's just a different mutation that's also affecting the waterfowl. So that random mutation then becomes highly pathogenic. That's why it is given that name. Pathogenic means deadly, basically. And especially we're talking about our farm poultry, but also our backyard flocks. And so we've been diagnosing lots of this in a farm that has, 12 backyard flock with 12 chickens and a few ducks and a few geese and a few guinea hens. And we're seeing those animals dying a lot as well. So even though what you hear in the news tends to be the large farms, right, it's certainly by no means just those farms that are becoming affected. So a backyard flock down the road can be just as easily infected, if not more easily, because a lot of those birds are going outside all the time. And so they're much more directly exposed to those waterfowl that are flying overhead and leaving their droppings behind and potentially landing on the same pond as some of the geese that are there already and mixing with them. So just without getting too much into detail, but when we talk about avian influenza, that's a really broad category. So that might be like we're talking about pickup trucks, right? So that's avian influenza. It's a pickup truck. That's about all you know about it, but it is definitely a pickup truck. There's ways that we can start classifying those. And so you might have heard about this H5. And so that's one specific type or one marker of the influenza virus. So that would be like saying, well, instead of I just have a pickup truck, now I can say, well, I have a Ford pickup truck, right? And then there's other markers on there. So this is a hemagglutinin, this is a neuraminidase, and so that's N1. And so that might be like saying, okay, well, now I've not only got a pickup truck, but I've got a Ford pickup truck, and it's a Ford F-250 pickup truck. And then we can get even further. And so what we talk about is 2.3.4.4. And sorry if this is getting a little bit technical, but now we don't only have a Ford F-250, but it's actually an XLT trim package on it. And then we can go even further and say it's red in color, right? So that's basically what we're doing with classifying these viruses, is that it's getting more and more and more specific. So this is what we're seeing currently in the poultry in Pennsylvania, is this D1.1 strain. And so this is the same one that's been causing problems since about early 2022. Last year, we had a pretty quiet year, actually. It was still there. We were still finding it. In other parts of the country, we're still finding it. But we had a fair period of time where we were pretty quiet, which was nice for us. But it's flared up again in the last few weeks. And we've seen a lot more of that. So what can flocks do in terms of biosecurity, right? We know it's out there in the wild birds. We can't get rid of the wild birds. So it's going to be out there. So biosecurity becomes important. Well, one of the things we talked about briefly was vaccines. Well, there's no vaccine that we can use in the US for high path avian influenza. There is certainly work looking at developing a vaccine that can be used. And there's been some trials in Europe looking at that. And again, there's also kind of a trade issue to be discussed as part of that. So what they would like to be able to do is vaccinate a chicken with an effective vaccine, and then be able to tell that that's a vaccinated bird, not one that has been exposed to natural virus. So talked about this already. So again, when we have organic birds, when you buy eggs, let's say free range, right, or pastured, right now those birds have to be locked up because of the huge risk that they are exposed to if they go outside. So that's something that the state veterinarian actually mandates to protect their health. The other way, so this is, sorry, touchpad's extremely sensitive today. So certainly these wild birds and waterfowl are a huge risk, but there's still the risk once a farm becomes infected, if they either don't detect that infection quickly enough, or if they don't follow good biosecurity, and somebody who's on that farm that is infected, the farm is infected, they go visit another farm that's not infected, they can take that virus with them very easily and cause a new infection. So the biosecurity plan has to both address the wild birds and the possibility of people or equipment coming in carrying the virus. And so that's, and sometimes we see that that's a problem. And we have epidemiologists who, every single one of these flocks that becomes infected, they ask a whole bunch of questions about, who came to visit the farm, did the feed truck come and visit the farm, and all that kind of stuff. And they try and solve that mystery about where that infection came from, if it came likely from the wild birds or if it came from another farm. And so they do what we call trace backs and trace forward, trying to figure that out. And again, as I already said, with lots of diseases, most diseases, prompt identification is extremely important. And so that's why as a lab here, we have an emergency testing schedule. And so we were here Sunday night till 10 o'clock testing some samples from farms where they suspected they might have the disease. Fortunately, those were negative. So that was a good result to have. All right, so this is where there's a difference now between what happens in birds and in cows. The chickens, one of the main signs that farms see is that birds start dying, like in huge numbers. And so as soon as this is diagnosed, as soon as we call the state veterinarian with a result and say, yes, this farm is positive, there's a red pickup truck on that farm, basically, right? We have that virus identified, then they will humanely put those birds down. And that's because there's no treatment available. There's nothing to treat this virus with. And the vast majority of those birds are going to die anyway. And so it's, in a sense, much more humane to humanely put them down than to let them suffer and maybe let 5% of them survive. That might be about it. But again, very high mortality rate if they're not put down. So that's why that's the action that is taken. And it also helps to spread minimize the spread of disease beyond that. But the big thing is that really it's preventing those animals from suffering. So. All right, well, what happened then about before this last couple of weeks, the biggest thing in the news here was probably about bird flu in cows. And so what um, the thought is that sometime in Texas, back in 2023, late 2023 or early 2024, there was some mutation that happened, whether it was in a single bird or in a single flock of birds, of geese or whatever, they don't know that. Um, but they can trace that back so that now that virus actually looks different, right? So rather than being that red pickup truck we talked about, remember the D1.1, this is the B1.13. And so again, it's a Ford pickup truck. It's a 250 with an XLT trim package, but this one is blue, not red. So it's extremely similar, but it's a little bit different. And so that's what we've got right here. And so this B1.13 can infect dairy cows, right? So the D1.1 did not appear to be able to infect dairy cows, and this B1.13 does. So that's kind of something that was new back in the beginning of 2024 when that was discovered. And just incidentally, um, there's a ton of genomic testing being done. So whole genome sequencing is being done on a huge amount of these viruses. Anytime we have a positive, they all get sent to the National Veterinary Services Lab. And so again, advances in technology, this is huge. So we can detect, but the National Veterinary Services Lab can detect these really, really tiny differences in these viruses. And what they've been able to do is track this B1.13 from Texas to herds in Michigan, to herds in Colorado, to herds in California. And that's really what has happened, where it's all spread from that single point source infection or spillover in Texas. Interestingly enough, it seems to really favor the mammary tissue, right? There seems to be some receptors in the mammary gland that this virus really seems to be able to glom onto. And so that's where it multiplies. And if you take samples from an infected cow, from the nasal swabs, you don't find it positive usually. If you take a manure sample, they're usually not positive, but 99% of the time you're going to find it in the milk. So that's just an interesting kind of thing about how this affects dairy cows. So what's different though with this B1.13 in dairy cows is that it does not cause death loss the way it does in chickens, right? The D1.1 causes in chickens, and actually I'll tell you in a second that B1.13 can actually go back into chickens and cause problems there too. But in cows, it does not cause any significant death loss. What you tend to see is that the milk production drops really significantly. Again, probably not surprising because it's affecting the udder. And so that's the main thing that herds report. Now, there will be some that they'll get a fever and they'll show some other things, but the main thing that farms see first is this milk production drop. Seems to spread through the herd pretty quickly. But the other thing that's kind of nice is that it seems to clear up pretty quickly most of the time as well. So you'll have a fair number of cows that get sick, drop in milk production, but then they tend to recover pretty well. And the virus is cleared from the herd. They do regular testing on that. One of the things, and this is true of any cow that is at her peak lactation, they can produce 140 pounds of milk per day. Any cow like that gets sick, when they drop in milk production, it can be difficult for them to recover that milk production after they regain their health. So there are some extra cows that don't recover their milk production to the same levels. And so some of those cows, they get sent out of the herd. They leave the herd earlier than they might otherwise because it's just not profitable to feed a cow that is not producing enough milk. So this is not really an increase in death loss, although there is an increase of removal of those cows from the herd. So again, the main way that this moves from Texas to, there was one case in Ohio, one in North Carolina, a bunch in Michigan, and some of those states I mentioned. So most of those can be tracked back to cows moving from Texas to Michigan, cows moving from Michigan to Colorado, and so on and so forth. But there's also evidence that people can cause some movement of the disease and potentially equipment as well. So when we're thinking of a biosecurity plan, right, we better be really careful about bringing cows in. And so there's actually biosecurity plan at the state level here where the state veterinarian has said you may not bring in a cow from an infected state without testing her first. So that's a biosecurity measure at the state level. So that's certainly a biosecurity thing, but we also need to think about people. So if we have a farmer here who goes to visit a farm in California, and that farm potentially has avian influenza in their cattle, it's extremely important that they either make sure they wash their clothes, or preferably that they leave their shoes out there. They don't take the same clothes back that they used when they visited a farm out there, because that certainly is a risk, and it's one that we can control. Now, one of these things, so we said that previously the red pickup trucks were affecting the poultry flocks, the blue ones were affecting the dairy herds. Interestingly, the current red pickup truck cannot infect dairy farms, but the blue pickup truck that's on dairy farms can go back into poultry flocks. And so that's been a huge problem in California recently, is that not only are the poultry farms there, or the poultry flocks, being exposed by birds flying overhead with the red pickup trucks, but the blue pickup trucks coming from the dairy farm down the road are also causing the same death loss in poultry farms. So quite a few of the farms in California, that the poultry farms that were affected, actually came back from the dairy cows, or came from the dairy cows, which is not a good thing. Again, not good biosecurity. So the one good thing is that even though that blue pickup truck that came from the wild birds got into dairy cows, it doesn't appear there's any evidence that that has gone back into the wild birds. So they're not the ones spreading it, by the looks of it. And there's been a lot of testing again by Wildlife Services to say, are we seeing this blue pickup truck in any of our wild birds? Because that would get really concerning. So, but we're not, they haven't been seeing that, and they've done lots and lots and lots of samples. All right, well, how big is the problem? There's somewhere, again, a bit of a moving target, 25 to 28,000 dairy farms in the country. This was back on 9/11, when I took this snapshot from the USDA website, and you can see there were 200 cases at that time, from when it started or first identified in March, through 9/11/24. There were 200, so that was less than 1% of the dairy farms were affected. And it actually looked, they tracked not only the total number of cases, but they also tracked what happened in the past 30 days. And so things were actually looking pretty good, right? There were still a few herds in Michigan, a couple in California, a couple in Idaho, a couple in Colorado here, but it was actually looking fairly good. And then, maybe not so good. So this is the current situation. California basically blew up. They've had well over half of their dairy herds infected now. And so they've been a huge driver in this number, that we now have 959 as of last night. I think that was February 3rd. Oh, sorry, February. No, yeah. Anyway, I can't read that because it's toolbars over there. So February 6th. So that was yesterday. So things do seem to be quieting down a little bit. Most of it now is out in California and Nevada still. One of the interesting things, and again, if you're paying attention to the news at all, one of the things that the USDA has done is started a milk sampling program. There's a couple of different versions of that. One is to sample at what they call the silo level. So these milk processors will have silos where they put milk from many, 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 many farms together before they pasteurize it. And so they're collecting samples from those silos. And they actually, in Nevada, found a red pickup truck in the milk. So before I said the red pickup trucks were only affecting poultry flocks. Again, if you've been following the news, there's been one farm at least identified now in Nevada, and so we don't know what that means. It's something that's kind of new and breaking news, but that's the first time that we've seen a red pickup truck in dairy cows. Right? They've all been blue ones before this. So is it alarming? I don't know. We don't know what it means yet, but it's something certainly to watch. All right. Well, what are we doing here? Just really quickly. So I'm sitting in the office right here at the diagnostic lab, and we're doing a lot of testing here. I'm sure you don't know what all these acronyms mean, but we're part of a national system. And so just before this started, I was on a National Animal Health Laboratory Network call that's run by the USDA. And so all the labs, there's 60 some labs across the country that are part of the NUL network. we coordinate, we have regular meetings, we share resources, we do trainings together. If necessary, like California was overwhelmed with the number of samples they had, they'll go to a different Nuln lab for testing. And because we're all part of the same system, we all have the same testing protocols. And so you test a sample here in Pennsylvania, it's going to have the same test done if it's tested in Washington State, for example. PADLS is our system here in Pennsylvania. There's our lab here at the Penn State University. There's one in Harrisburg at the Department of Agriculture, and there's one at the University of Pennsylvania, the veterinary school out there. So we all work together here across the state. Again, that's the test I was telling you about. So this is really good. I mean, we can pick out the pickup truck. We can't tell the color of the pickup truck here, but if we know that it's a Ford F-250 pickup truck with an XLT trim package, that's good enough. It doesn't matter if it's red or blue at this point. That the National Veterinary Services Lab will tell us that because we send all the samples there. But that's all that they need to know here locally, is that they don't care what color it is, just that it matches that definition. So all right, we're doing, especially with this outbreak now, we're testing on weekends and holidays. So Sunday night, we were here till about 10:30. We're probably gonna be staying late tonight. We're open tomorrow to do testing, because one of the other implications, this is on the poultry side now, if people are in close proximity to one of these affected flocks, they need to test their eggs before, or swabs from their premises before they're allowed to move eggs off of their farm. And so we call that pre-movement testing. And so that has to be done within 24 hours of them moving those eggs off of the premises. And again, that's a biosecurity measure to ensure that that farm didn't become infected. They're still negative. And so if they are negative, then they're allowed to ship those eggs. And so again, that's food safety testing in a sense, but it's also biosecurity testing to make sure that we're not spreading, or they're not spreading disease by moving those eggs off the premises. So again, we're doing that. That's the cattle and bird egg movement testing. So if cows want to move from Pennsylvania to New York or Ohio or Maryland, they also need to be tested. So we're running some samples for that today, because there's some cows that are moving. I'm not sure which direction. If we get a call from the state veterinarian, and so this is, Saturday at 12 o'clock, they'll call and say, hey, we had a farmer report a significant increase in the number of deaths in their birds, then somebody will go and collect those samples. They'll drive them straight up here, and we'll test those on Saturday or Sunday or Friday morning or whatever, so that we can get an answer to them as quickly as possible. There's a couple of voluntary programs. We have one here in the state where dairy farms could sign up and submit a sample every week. We didn't have many farms participate in that. So we're currently doing a statewide mandatory milk testing program that the Department of Agriculture has implemented, and we're doing all the testing for that here. So basically all of the dairy farms in Pennsylvania have been tested. I think we're at least 5 times now. And so we haven't found any positive samples, and that represents approximately 25,000 farm sampling. So we have about 5,000 farms. We've tested them about 5 times. And so we're up to about 25,000 farm samples. And now they're collecting them at the truck level, but that's a technical detail. So we feel, and the state veterinarian feels very, very comfortable that we don't have any blue pickup trucks in our dairy cows here in the state, because we've done extensive testing. We haven't seen any signs. Veterinarians have not reported any signs. And so it doesn't mean we can let our guard down, but at least we can feel pretty comfortable that we don't have it at this point in Pennsylvania. All right, probably butting up against time here, so we'll just go fairly quickly. But not surprisingly then, dairy farmers, but also poultry farmers, need to think and act biosecurely, right? So again, we might have some things that we do specifically for highly pathogenic avian influenza, but just understanding the general biosecurity principles will go a long ways to reducing the risk. Again, prompt identification is extremely important, whether it's in a dairy herd. And again, one of the other labs today had a call from the state vet and said, hey, we've got some sick cows in this farm. We don't think it's high path AI, but let's test it just to be sure. And so that happens fairly regularly, trying to be safe rather than sorry. And then this voluntary testing program, we talked about, that hasn't had as much uptake as the Department of Ag had hoped. And then talked briefly about this, but again, a very different response if this happens in a dairy farm, because it tends not to, it's not nearly as deadly as it is in the poultry side of things. So milk from sick cows is never allowed to be sold for human consumption, and so that's just a general rule that the Food and Drug Administration has. And so, if a dairy farm here in Pennsylvania would get the blue pickup truck, the highly pathogenic avian influenza in the cows, then they could still sell milk once they meet certain guidelines. You know, there would be probably a couple of days when they couldn't. But as long as they can document that sick cows are, their milk is not going into the bulk tank, they can still sell that milk, and it would go for pasteurization. And as I'll tell you in 2 minutes, pasteurization is, you know, wildly effective against any virus that might be present in the milk. So then the Department of Agriculture would do regular testing on the herd, and they kind of let it run its course, right? So they treat the cows, they give them a lot of fluids. That's an extremely important part of this. So similar to people, when you're sick, right? Probably the most important thing you can do is fluids, 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 and fluids. It's the same with dairy cows. It gets to be a lot of work because you can't tell a cow to drink extra water or feed them chicken soup, but you actually usually have to pump their stomach with fluids, but it can be an extremely valuable method of treating those cows. So it's a lot of work for the farmers, but it can be effective. So, and then the USDA has stepped up, and they have for a long time already for poultry farms that are affected, but for dairy herds, they do have funds available to help them with any lost milk sales, to help them deal with the disease. There's some different things that they have, but again, there is support there from the USDA. All right, in terms of consumer, this is, I think, the last slide, so you can breathe a sigh of relief. Um, again, there's been lots of studies because, you know, naturally people said, well, okay, dairy cows are getting this. They are not being put down the way chickens are. So is there a concern about milk potentially having this virus in it? And there's been a lot of studies, CDC and other and universities have done these, and they've said, well, we might be able to detect some of the genetic material, the genetic fragments of the virus in the milk, but there's no live virus, right? So when you pasteurize something, you kill the bacteria, kill some bacteria that might be in there, or kill the viruses, the harmful viruses that might be in there. And so you can still find some evidence of the dead bacteria or the dead viruses, but there's been lots of work to show there's nothing alive in there, so nothing that can cause an infection. The question becomes, and I don't know if any of you drink raw milk, but it's legal to sell raw milk here in Pennsylvania. And so the question becomes, well, that milk is not pasteurized, so is that a concern? Well, first of all, I've already said that there's no evidence that that strain, the blue pickup truck, is present in Pennsylvania, right? So that's a good thing. And that means that currently there's shouldn't be any additional risk on the raw milk side. We could discuss that separately as a separate issue, but in terms of the highly pathogenic avian influenza, we don't have it, so it doesn't seem that it should be present in raw milk. But if we would get it here and a raw milk herd, a raw milk farm would get it, we don't know what the potential risk might be to people. If you would drink that and there would be some virus in it, it wouldn't have been killed because it's not pasteurized. And so again, we just don't know what the potential risk might be there. But again, you know, I think caution is probably a good thing to throw to observe caution there. So, all right. So one of the other things is, well, is there a concern about people being exposed directly to the virus, either the blue pickup truck or the red pickup truck? And not surprisingly, for the average person out there, the way they'd be exposed to that is if a duck flies over the picnic table and, you know, poops on the picnic table, there's potentially some virus there. But the people that are really in close contact with this virus potentially are the farm workers, right? The farm owners and employees. And so what's been reported is that there are people that have pretty minor symptoms, and most of that is some redness of the eyes. And they tend to recover pretty well. So again, there's always concern about, you know, is everybody reporting it? Because a lot of the employees on farms might be concerned that they don't want to be tested, and they might not have the correct paperwork that they should. So there is some concern about that. But so far, the evidence is that this might be associated with some mild disease in people, but the the evidence is that those people recover. Now, you might have heard a story that there was a death associated with this high path avian influenza in the US here fairly recently. That was thought to be a backyard flock exposure. If you read the story, and again, I haven't done a really deep dive on this, but many stories report that this person had significant comorbidities. That's the term that's used. And so that means that this person might have had heart disease, might have been diabetic, might have had pneumonia, but they did find this highly pathogenic avian influenza on this person or in this person. So I'm not sure it's completely fair to attribute to the death of that individual to the high path AI. Again, I think we need to be careful, but I'm not sure that we have really proven, Koch's postulates by doing that. So again, I think it's good to be cautious, but I think we have to read carefully what is being reported and what's not being reported, and if there's enough science behind that to actually draw those conclusions. There's also evidence, if you start hearing this, we can find it in cats, and that's true. We can find it in wildlife, but we've probably not looked that much in wildlife before. There's a huge effort right now to look at that. So sometimes if you don't look for something, you're not going to find it, right? So if a lot of our wildlife might have had this red truck virus before, but they were asymptomatic, they were not clinical, we might not have tested them because they died in the woods and nobody ever checked them, or they looked healthy and nobody ever thought of testing them for that. So again, there's still some questions that we need to answer before we can, kind of draw put a period behind that sentence. So, all right, so I will stop there. And I see there's a couple of questions here in the chat. So let me have a look at those. And continue. So what happens to hearts after the 6 to 8 weeks? Is that herds maybe after the 6 to 8 weeks and a herd is clear? Okay, yeah, so what happens to herds after they've cleared the virus? So yeah, the milk, while that herd is infected, as long as they're not selling the milk from the sick cows, they can continue to sell milk for pasteurization. So they're allowed to continue to do that. Once they have cleared, there's no more virus detected after that approximately 6 to 8 weeks. Some might take an extra week or two. Then basically the restrictions are removed. There's no more testing that needs to be done then, and things like that. So it's not nearly as dramatic of an effect as it is in poultry. And mostly it's business as usual, except there's extra testing being done. And then what are the after effects on milking herds? That's an excellent question as well. So one of the things, oh, sorry, there it says herds, not hearts. Okay. One of the things, as I mentioned, that more of those cattle will tend to leave the farms. And so I think that's true because those cows definitely were affected, and sometimes it's difficult for those cows to recover in milk production. So that's one thing. You might have heard in California, they were seeing some more death loss in cows there. There were some cows dying more than they had seen like in Michigan or Colorado. And the thought was because they were having very high temperatures at the time, heat stress is certainly something that's a concern for cows, even when they're not infected with another disease. And so it was probably a combination of the virus and the heat stress that was causing more cows to die in California than had been observed in most other states. And then other after effects. So there has been some evidence that in some of these herds, there might be some abortions occurring at a higher rate than you would expect. There's always a low level of abortions that happens, but some of these herds, it looks like they might be at a slightly higher level. And again, just like with other diseases, if you infect a cow and she has a fever and she's feeling sick for 6 weeks, that she has an increased chance of having an abortion as well. So how much of that is directly attributable to the virus and how much of that is just because she had an infection is not completely clear, but there are certainly some effects such as that. So they're relatively minor, but there are some, and especially as more and more herds get affected, you can start to see some of these really small differences that might occur. Okay, so great questions. Similar presentation for livestock 4-H. Yeah, absolutely. Yeah, we'd love to do that. And again, I think that's something to be really happy to do. So, Cara's then immune to it. Yeah, so another really good question. In general, influenza viruses do not stimulate very long-lasting immunity. again, we haven't had a lot of herds that have been infected or have been cleared the infection for long enough to know how long they stay immune. And then we also talk about two different things. So there's individual cow immunity, and then there's also what we call herd immunity, right? So if you have enough animals within a herd that have some level of protection, that conveys broader protection to the herd. There's certainly evidence that individual cows can become reinfected, although we can't completely rule out that they might not be a situation where they were clinical with the disease, they became subclinical, and then they flared up with clinical disease again. So that's always a thing that we have to answer and make sure we have good data to support, is whether or not that's happening, because that is a possibility. So there have been some cows that have either flared up again or gotten reinfected, but that's a relatively small percentage of the total number of herds that have been infected over the course of this outbreak in cattle. So good question. There is effort being made by USDA and private companies to develop a vaccine for the blue pickup truck, the one that's in cattle. And so there are actually tests underway for that. I have not heard anything. It's been a while, so I don't know if that means it didn't work. Sometimes that's the case when there's a lot of announcement about we're going to start testing this, but then you don't hear anything. That sometimes means it didn't work. Or it might just mean we haven't had a good enough chance to see the results yet. But there is certainly effort being made to develop a vaccine for cows. All right, any other questions? Let me go here and stop sharing. You can see my ugly mug full screen. But any other questions, comments? I'd be happy to address those. You can always email me just in case. Did I do that right? There we go. You can always email me if you have questions, or if you want me to if you want me to do something for your class, for 4-H kids or whatever, we can see what we can make happen. So if you email me and I don't answer, just email me again. And if I don't answer, email me again. I've got like hundreds of emails, and I'm trying to stay on top of them, but I'm not always successful, I will admit. So,
Well, thank you so much. That was a lot of awesome in-depth information that people can definitely bring to a lot of different subjects. It was really cool.
well, good. So just watch out for the flying blue pickup trucks and the red pickup trucks. So I don't know if that helps explain a little bit how the viruses, I mean, they're extremely similar, but they are definitely different. And so it's just kind of interesting how genomic testing, I mean, it has really exploded with this outbreak. It's just the amount they're doing is staggering at the national level. And so,
Yeah, I think that was a really good analogy to help people wrap their heads around it. So,
yeah, I'm sorry I picked
mm,
the Fords. I don't know if we should have picked the Chevy maybe or whatever, but so no slight
cool.
intended. I actually drive a Ford. So.
All right. Well, with
Okay.
that, the post test is in the chat. So if you all could take that, that helps us, show that you learned things. And look for an email tomorrow with that resources packet. And thank you all for joining us. And thank you, Ernest, for doing this presentation, especially with it being so busy. We really appreciate it.
Yep, very happy to. I'll go back and see how our molecular team is doing in terms of testing the samples we got today. So I will, that's the next thing on my list. Again,
Sounds good.
pleasure. And again, if you have any questions, please don't hesitate to reach out.